Hello,
Yeah.
friends. Here's a very special guest today on KR Talks. One of my college buddies, one person with whom uh, we've been together for quite long, and we do miss each other. And this is Amit Chabria. Hi, Amit. How are you?
Hey, 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 Krisha. Thanks for a warm introduction. Yes, I do miss you a lot, brother. You're in UK. I'm over here. Time zone differences, and the worst part is I can't meet you. You stay 20 minutes. You used to stay 20 minutes away from me. Now you're a 20-year flight away, like non-stop. If I take, I'll reach in 13 hours, but 20 hours.
So we used to have this Chinese bale and this lime juice. I remember.
uh, Having it during our college days. It was really fun. All the unhealthy stuff that we had taken, now it's coming out. It's actually coming out of the body.
Yeah, I think now we are in a detoxification, and I
Yes.
think we've had a lot of junk food, no doubt, but now I think it is time to realize that
Us.
long-term sustainability, long-term sustainability is something that we have to aim for because we are going to be here hopefully for another 40, 50 years unless we get
Yeah.
COVID-19 and
Yes. I don't
so
think we
how's
would. We would. I think. Yeah. Yes,
why do you
Krishna.
think I will?
No, no, no. I'm saying I think we won't be getting it quite easily. I believe we are into fitness and we are taking proper precautions before going out, wearing a mask, or having gloves on our hands, and using proper care. And the best part about our lives or our way of routine is that hardly any interactions. Even if we have interactions, we maintain a good distance. And if we take proper care, it's like it can happen to anybody, but if we take proper care we can at least prevent it. We can be at a better stage. I feel really sad about people who have lost their lives because of scenario going around the world. But I hope everyone takes proper care, everyone wears masks, everyone is using gloves, not like reusable ones but the disposable ones, and they dispose it properly, even the mask, even the disposable mask that people are using. I think it's more on the lines of people preventing it than people finding a solution to it. In the market.
Yes, that's right. I have one thing to say,
Yeah.
and
Yes, Kishore.
and I was speaking to my mom yesterday on the phone, and we were just talking, that I don't think
Mm-hmm.
anyone in this world is safe from coronavirus. Because my mom, she
Okay.
told me yesterday that there are people who are not going out and they are
Yeah.
getting infected. People who are going
Okay.
out on a regular basis, they are not getting
Yeah.
infected. So
Okay.
the point that I'm trying to make is that not going out is still not the solution.
Mm-hmm.
I think the solution is to have a good immune system because the number of
Yes.
cases that we have seen.
Mm-hmm.
So what happens? I'll just quickly explain what
Mm-hmm.
these new
Sure.
cases mean.
Okay. I
I
would love to hear.
am a person, yeah, sure. I get infected with COVID. Okay,
Okay.
all great. A few days later, the symptoms start showing. I
Okay.
get any symptom, I become asymptomatic to the COVID virus.
Mm-hmm.
Then I go
Okay.
for a COVID test, and now the
Yeah.
test, the results are either positive or negative. Now, if the result is
Yeah.
positive, then I am contributing to the new case in that country, in that region, at that day.
Mm-hmm.
Okay. So
Yeah.
the actual number of people who have who either have COVID or have been through COVID
Yeah.
is much larger than what we
Yeah.
can see on the Worldometer website, where they are counting cases in each
Yes.
country. So imagine you
Mm-hmm.
could have been through COVID and you don't know because you've
Yeah.
got a good immune system. You've been taking care of yourself. And
Exactly.
I think I
Yeah.
have also been, because I've been to London, Birmingham, Brighton, and
Okay.
and
Mm-hmm.
uh, uh, a few places which had lots of people. Like there was lots of people. What are your thoughts?
Okay.
What are your thoughts? Do you think that the point that I'm making is exactly the situation, or
Mm-hmm.
do you have something else to add on?
The point you're making is very logical, but the thing is, it's about the food habits. I believe if you eat homemade food, if you eat good food, it's gonna help you. It's more on the lines of what you consume and your body reciprocates to it. So if you're having good food, if you're maintaining a healthy diet, and if you're working out enough to keep your body warm. You keep your body, fit enough to fight any bacteria that is entering, bacteria, viruses. So antibodies get released. Antibodies are active that time. And if even anyone of us is catching coronavirus, our antibodies just start reacting to it before they get adapted to it. They'll start fighting it. They'll try to remove it from our system. And it's very important to maintain a good diet and wherever we go. And plus, I want to say again that if we maintain social distancing and take proper precautions, we can, avoid getting coronavirus. It's not, I think many people have already lost their lives. I think it's more on the lines of taking stress, ability to think so positive about their own health that it turns out to be very negative. Like the thing is, I'm positive, I'm corona positive. That means I'm not going to survive. I've seen that's happening that way. Not seen, but I've heard of that's happening that way. People are worried, families are worried. But I think it's the important thing we should all do is support each other, support the person who has got coronavirus, and support the frontline workers who are fighting on daily basis to keep us safe. I would really like to thank our police system, our government, and everyone, especially the doctors who are not caring about their lives, wearing PPE kits for, let's just say, 12 to 14 hours just to keep us safe. Even if, even not even if, but the thing is, country like India, where the population is very high, and like in the past, people were saying India is the first country to get a lot of coronavirus cases, not because of the population, because of social distancing. Or over here, I have noticed, in my opinion, that average family is of 6 to 8 people. That's a lot. And the people over here live in small houses. Not everyone can afford a really big house to have separate rooms, to maintain proper social distancing and take care of them. Some of us in some of our areas, we don't even have proper hygienic systems in place. So I think if they can survive it, they can, actually fight it. Like, this system can fight it because they are maintaining their health, they are maintaining the norms, they are maintaining their own self. That's how we grow, right? To keep ourselves going.
Yes.
We should be scared about this virus, but we should not let it rule our minds. We should not let it rule, because in our subconscious mind, if it gets that I'm scared of coronavirus, I might get it, I'll fall sick, and I don't know if I'll be alive 2 days later. If that's the attitude, then the virus is going to act more. The virus is going to be like, ये तो पहले ही डर गया, चलो और डराते हैं. And it's not the
Exactly.
virus, it's your inner thoughts telling you. It's your guilt, it's your fear, it's your anxiety, it's your stress, everything talking to you at the same time. Everyone saying, Amit, you're scared. I'm going to scare you more. I'm going to scare you. I'm going to like bring you down to the lowest level that some of us, unfortunately, are not able to handle it.
I have one thing to add on.
Yes,
In this situation, I think what works best
yes,
is that we think rationally. Okay, there's a virus, there's a pandemic. The virus will
yeah.
some or the other day uh, uh, get into my system.
Mm-hmm.
For people who think that their immune system is weak, what you can do is start working on your immune system from now. Eat healthy, eat vegetables, don't eat processed
Mm-hmm.
foods, processed meat.
Yes.
Start focusing on a more sattvic lifestyle. And if you want to know more about the sattvic lifestyle, sattvic foods, you
Yes.
can Google on you can type sattvic foods on Google, and you'll get a list of the sattvic foods. If your immune system you think is
Yes.
strong, you still need to make
Yeah.
sure that it is strong,
Mm-hmm.
and you do not need to take your
Mm-hmm.
immune system for granted. Okay, I'm strong, so I'm going to eat
Exactly.
any shit. That's not how it works. If your immune system is weak,
Exactly. And
make it strong. If your immune system is strong, keep it that way.
exactly. Exactly. One needs to understand the value of his inner body. We always talk about our mental health. We always talk about inner peace, but what about our internal organs and what about the inner body? We have wounds because they're external. We can see them, but our inner body needs health, healthy, like diet too, so that it can work in the most effective way. I totally agree with you, Prashant, on this. Not to eat junk food. I will still suggest please avoid junk food. It's not good. Burgers, pizzas will just get you fat. Please eat sattvic food if you can, or you can have a really good maintained diet where you're consuming enough calories and you're burning enough calories to stay fit and do good.
On that note, I'm just going to add one
Yes,
point is that
yes,
your body is your temple, and and as Sadhguru says, if you eat food which has life, fruits,
mm-hmm,
vegetables, nuts, legumes,
exactly.
grains, honey,
Mm-hmm,
black pepper, spices, these foods have life. If you eat
yeah,
life, you will get life. If you eat dead food which is processed in the factories, how can you expect to
yeah,
live a good life? That's for
exactly.
and that's the message for today. I want to thank
Yes,
It for being a part of this show. We look forward
yeah,
to speaking and learning more from you about your fitness journey.
sure.
Do you have any last thoughts to share?
I hope it is good to, yes, it is really good, Trisha, to talk it out. It is really good to send out a message that everyone needs to hear. And better coming it from me and you. I know hundreds of people are talking about it, but who is taking action? It's we who need to take action. I know everybody wants to stay healthy. Everybody wants to stay with their families for real long. Everyone wants to see their children grow. Every grandparent want to see their grandchildren. So for that, I request you, please stay healthy, eat healthy food, and also maintain social distancing and take all the necessary precautions to keep your immune system strong and fight this virus. Thank you so much, Kushi, for having me today. It really means a lot to me. Namaste.